Hi everyone, my name is Manpreet Dhillon. Many of you know me as Marina, and hi to everyone who is listening in. I had the privilege of working with a very supportive team in an area that I, quite frankly, never knew I would enjoy so much, which is working with data and numbers, particularly in audit and analysis. So my practicum experience revolved around a quality improvement project with Island Health's Right from the Start program. And this program uses a population health approach to provide universal and enhanced services in order to support women throughout their pregnancy and postpartum. Public health nurses are the frontline staff who provide care and build these relationships with the women in this program. And part of what comes out of this supportive process is maintaining accurate and complete documentation. This was examined to observe and interpret interesting data that was recorded in clients' electronic medical records. And the information from this would guide future quality improvement, which may ultimately improve clients' health outcomes and well-being. So this project primarily focused on the right from the start enhanced services where the population was at risk for vulnerabilities due to social conditions of risk. So this is the program workflow for the enhanced services. And it begins on the left with entry into the program via prenatal registration. And after this, one pathway from A through F is assigned per client. The pathways of interest for this audit and analysis project were pathways A, B, and C as circled in red. Pathway A is for selected populations, so for example, women who identified as having Aboriginal heritage or women who were from geographically isolated areas. Pathway B was for women who were experiencing symptoms at risk for postpartum depression. And finally, Pathway C is for enhanced care where individuals can identify with 2 or more vulnerabilities from a specific list. So all 3 pathways involved nursing assessment as a prenatal service, but Pathway A offers home visitation, whereas Pathways B and C involve care and counseling and education, referral to other public health supports, and telephone follow-up. So this quality improvement project involved a retrospective audit and analysis of the Right from the Start program for both West Shore and Souk regions. After analysis, a patient journey map was created to understand a patient's horizontal journey through these pathways. Further data collection was limited to prenatal registration until 2 months postpartum for a fiscal year, and all records were used for a complete clinical audit, which was really labor intensive, but it was fun. It was really fun. But I will present a more in-depth look into West Shore alone. So a bit of background, in the context of maternal quality care, literature has found wide variation in clinical practices and patient outcomes in North America, which indicates inconsistencies in practices and room for improvement. So what audits are a type of quality improvement that consists of measuring a clinical outcome or a process against well-defined evidence-based standards. An audit can be visualized as a quality loop, which is on the right side over there, starting with an issue at the top, which can be easily evaluated, and moving through the loop to create sustainable solutions. So this cycle is ideally continuous, and it produces more queries and opportunities for improvements. So patient journey mapping is, interestingly, a form of audit as well, and it is essential in understanding health processes through a patient's perspective. So this type of mapping is easy to understand among various stakeholders, and it's very visual. And the most effective maps utilize lean thinking transformation. So what this concept is about is it looks at the most essential steps and only uses those in the pathway which are related to a client's health outcome. So this may result in improved provider performance, less waiting times for patients, reallocation of resources, and more vertical and horizontal collaboration. Literature recommends having 4 to 5 staff for mapping, but for this project I was able to consult with 4 island health knowledge holders. So in preparation for data collection organization, a project charter and chart audit protocol were created in consultation with these key island health staff. Audit and analysis were possible through the compiling of data from Panorama. So what Panorama is a database that streamlines patient data and houses electronic medical records. So data was collected and organized using non-meaningful client identifiers into a Microsoft Excel sheet, according to various sections under prenatal and postpartum periods. So prenatally, information was gathered on referrals, gestational age, whether or not a client had first birth, and prenatal supports and resources identified from the records. And postpartum, only dates of postpartum assessments as well as postpartum supports were collected. After analysis, a patient journey map was created. So this is a quick and easy breakdown of the client proportions in each pathway. So there were 19 clients that were found in pathway A, as indicated in blue, 9 found in B, which was indicated in orange, and 29 were found in pathway C, which is indicated in gray, which you can easily see contain the largest number of assigned clients, which is at 51%. So here we are looking at referral sources for clients who entered the program for West Shore as a whole. So the highest type of referrals were from clients themselves at 40%, which was matched with pregnancy outreach programs, also at 40%. And it was interesting to find that referrals from healthcare provider clinics, which is seen in the blue, was at the lowest at 9%. The other referral source, shown in yellow, upon investigation was found to be exclusively from social workers. So what do these numbers mean? A positive is that clients are able to refer themselves, and a large proportion are aware of the program. Similarly, pregnancy outreach programs, they're able to reach hard-to-reach clients. And now it seems like healthcare provider clinics are not referring clients in the same capacity as what it looks like. But this may be because they simply aren't aware of the program itself, or clients either do not have or utilize primary healthcare providers, or there might be something else going on that elicits further investigation. So after all the data work, the retrieval, the collection, and analysis, this is my baby, the patient journey map. So I created 2 of them. This is for West Shore, and this is one of the main deliverables. So this visual collated the essential pieces of data that was found that pertain to a client's journey through the Right from the Start program. It looks like it's daunting, but we'll be looking at one pathway, which is to the very far right, which is pathway C. So this is pathway C, and it's split into prenatal and postpartum sections, as seen in the gray boxes at the top. So I'll draw your attention to the blue box that says pregnancy under the prenatal section. So this marks the beginning of the journey. The next steps are referral, then prenatal registration, and then after this point, there are 29 clients that are assigned to pathway C. So the next few steps after that are for the referrals, and at the very bottom box, we can see a very crucial assessment, which is the prenatal follow-up, and yet only 6 clients out of 29 receive follow-up assessments. So following the arrow to the postpartum section, after delivery are postpartum assessments over here. So some other key details are the prenatal and postpartum supports listed on the side of the pathways. Also, 3 clients identifying as Aboriginal were found in this pathway when they are typically assigned into pathway A. And finally, the average gestational age at program entry is seen in the yellow circle as 19 weeks. However, despite this average, there were a few clients that were found to be closer to the delivery date. So the main results or the main takeaways are the lack of prenatal follow-ups were found to be related to clients not contacting public health nurses back. It was also due to women being in a later stage of their pregnancy. So upon entry into the Right from the Start program, if they were in later gestational age, there were less opportunities to undergo or receive these follow-up assessments that were critical. And finally, the largest referral sources were from clients and pregnancy outreach programs. However, referrals from healthcare providers were extremely low, and it wasn't found why through the documentation. So for future quality improvement, It may be beneficial for appropriate public health staff to review the program workflow and documentation practice, as there were some clients assigned to non-typical pathways, and this may create health inequity in the future. So involving public health nurses as well as clients in future quality improvement initiatives may bring their insights and experiences to the forefront, and sharing that knowledge with them and key community stakeholders is beneficial. Lastly, surveying past clients on whether or not they have primary healthcare providers would help in determining why referrals from healthcare providers are low. So in closing, I'd like to acknowledge the following Island Health Project team members for their expertise, their time, their guidance, and support with this quality improvement project. This would not have been possible without them. I'd also like to extend my gratitude to the PHSB staff for working tirelessly with students to ensure that we all have a positive practicum experience. Thank you.
Well, thank you. That was very, very interesting. Any questions?
Hi, awesome presentation.
Thank you.
One of your recommendations was to increase awareness of the program.
Yeah.
Did you guys come up with any concrete ideas of what you might do to increase awareness?
Because this was sort of it's almost like not a pilot project, but the first comprehensive clinical audit in this program. We weren't able to discuss that or figure out the next steps in that way, but that is more in terms of what would be on the agenda for future quality improvement initiatives, I'm hoping.
Yeah.
So, yeah, we didn't discuss that, but yeah.
Any other questions? I have one. In terms of the referrals, were there any people who were referred to the program who weren't eligible? And then what would happen to those people? Or was it almost 100% acceptance?
The Right from the Start program has an enhanced portion, so enhanced services as well as universal. So those clients would go into the other pathways. So A, B, and C were more in terms of the enhanced care services. Right. So they would all be serviced. So the ones that are universal would be things like breastfeeding, consultation, and things that are postpartum and prenatal in accordance with their needs. Yeah.
Thank you. Well, Ken, thank you very much for excellent.